Do you want me to go on and dive in?
Sure. Yeah.
Okay, great. Awesome. Hey, thank you all so much for joining us this afternoon. My name is Mary Shelton, and I'm going to kick us off. We're going to do some introductions. We will take questions at the end of the presentation. You may also enter those into the chat if you would like to, and David will sift through the questions and give those to us at the end. All right, David, next slide. Okay, so in today's webinar, we're going to do introductions, describe the process, and then how we're going to disperse the funds. So we're going to have an introduction about who the Opioid Abatement Council is, who is managing the disbursement process, and then also what are the factors that are considered and tasks which are needed to disperse the funds. And then also, as you know, the council is entrusted, excuse me, to disperse 35% of the funds, and we're going to talk a little bit about that. All right, next slide. So let's do introductions. Michael, you're up first.
Excuse me. My name is Michael Lepwich. I'm a senior deputy with the Tennessee Attorney General's office. Chris Dunbar is also, I believe, on the call today. And we have been working along with a number of other people in the office in all sorts of aspects related to the opioid crisis and addressing it through essentially going and getting funding, part of which is going to be discussed today through investigations, lawsuits, and negotiated settlements. And so those of you who are in your positions a couple years ago are familiar with the sign-on process we did with much of settlements. And so we hope we were a good resource there, and we look to continue to be a resource to everybody, both in addressing funds from prior settlements and perhaps looking forward to additional settlements.
Awesome. Thank you, Michael. Dr. Lloyd, have you joined? So Dr. Lloyd will be joining us during this presentation. He is actually speaking at a jail right now. So Dr. Stephen Lloyd is the council chair. He was appointed by the governor. And then I'm Mary Shelton. I'm the executive director of the Tennessee Opioid Abatement Council. I've been in this position since September, but I'm a career state employee serving both at the Division of TennCare and the Department of Mental Health and Substance Abuse Services. All right, next slide, please. I'll have this slide again later in the presentation, but I know there's a lot of questions out there about how we're going to be able to disperse the money to all 95 counties. And this is a quick high-level overview of the payment process. Right now, we're confirming the remittance addresses and contact information. The Opioid Abatement Council office has been calling and emailing all the counties to make sure that we have this correct information. So thank you guys so much for getting back in touch with us and sending that information. Next, we're going to be determining the payment amount for each county, and Michael will go over that in a few minutes. Then once we have all of that figured out, we will be sending letters of agreement to each county, and this will be through Adobe Sign. So the idea here is that it should be a pretty easy process. Then we will be processing those payments via Edison, and they will go out as electronic payments. Now, there's a lot of other bits and pieces and tasks that have to happen in between all of those steps, but at a high level, that's what we're looking at in order to disperse the money to the counties. All right, next slide. And I'm going to ask again, Dr. Lloyd, have you joined? All right, I'm going to dive in. And David, if you see him join, could you just interrupt us?
I will. Okay. Keep a watch.
All right, thanks. So I'm going to give a little bit of background on the Opioid Abatement Council. And this is a picture from our second meeting that was held in Knoxville. This was our first working meeting, and this was September 30th. It was a great time to get together, meet everyone, and we had quite a number of guests as well. All right, if you could go to the next slide. So there are 15 council members, and they are appointed by various entities. They're appointed by the governor, the Speaker of the House, the Speaker of the Senate, this association, the Tennessee County Services Association, and then also the Tennessee Municipal League. The members are serving staggering terms. Some of the members are serving 4 years, while other members are serving 5 years. And the council members are from across the state, from Jackson, Upper East Tennessee, Chattanooga, Nashville. We have a variety of different types of professions, from doctors to retired sheriffs to folks who have been working in the prevention and treatment field. And we are meeting quarterly. Oops, we seem to be, yeah, there we go. Thank you. We are meeting quarterly. We have met in, our very first meeting was in Nashville in July. Then we met in Knoxville in September. We had our most recent meeting in Jackson, and that was December 5th. And then our next meeting will be in Franklin, and that will be on February 27th. So a lot of good progress being made, a lot of great discussion around both the disbursement of the money to the counties, but then also setting up a community process where people can apply for grants. All right, next slide. This is pulled from Public Chapter 491, which is also now in statute, but to give you an idea about the responsibility of the council. The council upholds the responsibility to ensure the disbursements of these funds go toward funding programs, strategies, expenditures, and other actions. And then also to design and prevent and address the misuse and abuse of opioid products, and then also treat or mitigate opioid use or related disorders or other effects of the opioid epidemic. So that is what the council is entrusted to do with the Opioid Abatement Trust Funds. So just wanted to set that up real quickly. It's in a way a unique situation that there is a council that is in charge of this the trust fund, and they will be working along with the Attorney General's office, this association, and others across the state to make sure that this money gets out to the counties and then also the community. Okay, I believe we're ready for the next slide, and I'm going to turn it over to Michael.
Thank you. We can advance to the next slide. So I want to step back a little bit and talk a bit generally about where money from the opioid settlements is coming from and getting to the counties. So for the counties, there are two sources of funds. Now, the first source of funds is a subdivision fund, and that money is being paid directly to the counties, and the counties generally should have already been able to receive those funds. So far, there have been 2 payments from the distributor settlement and 1 large payment from the Johnson & Johnson settlement. And there's a national settlement administrator that your all's offices have been dealing with as far as providing information and about wiring instructions and everything else, and those payments have been coming in. So that's the subdivision fund. Obviously what we're going over today is what in the settlement agreements is referred to as the abatement fund. It's the largest of the funds. And a couple of years ago, in anticipation of having these national settlement agreements in which substantial funds would be coming in, the legislature created an opioid abatement trust fund where 70% of the funds coming into the state will go, and they have to be spent on future opioid abatement. The legislature also created the Opioid Abatement Council to administer those funds, and they are up and running, and in fact, they've already identified a wide range of programs that can be funded from the settlement monies. The third thing that the legislature did when it comes to these opioid abatement funds is they set aside the 35%. So that was done by the legislature in anticipation of these settlement agreements and perhaps some future settlement agreements. And those 35% of the funds are directed to the counties. And so the allocation is a little bit different. Obviously, it's running through this Opioid Abatement Council and the trust fund, the math is a little bit different as well. So with this money, only counties are receiving the money, whereas a number of municipalities are receiving money from the subdivision fund. And the legislature identified some points of data to use in determining what every county's allocable share would be. And the opioid, and we had an agreement with some negotiations with subdivisions and came up with the formula that would be used to determine those allocations. So the county allocation formula and the percentage that results for each county is based on Tennessee specific data. So we have fatal overdose data, non-fatal overdose data. All that information is collected by the Department of Health. We also have a measure of opioid sales, kind of seeing how many pills ended up in each county over a period of time, and we use county population. Those data sources were put together and they generate the allocation percentages for each county. And pursuant to statute, this will be updated every 4 years. And so it'll be an ongoing process. So where if the problem becomes worse in one area of the state, the data will catch up to that and the allocations will change. I don't think it'll be a drastic change over time, but can change if there is kind of a change in generally where the worst problem is in the state. Next slide, please. So in coming up with these data points and everything else, it was recognized that there is the possibility that the data that we're collecting may not fully capture the situation in every county. There could be a data issue with a particular county, perhaps maybe with overdose numbers for a particular year or something like that. And so the thinking was when we were working out how the allocation percentages would work is that we would potentially hold back 2% of the funds to see if there was any dispute about the allocation percentages for a particular county. And so if the county does think that the data that was used did not result in what was flawed in some way to where they believe they have a case for a larger allocation, there's a procedure that would allow that case to be made. Now, we're not really anticipating this. We have had the county allocation percentages posted for over a year now, and there haven't been any concerns raised, but there is a provision for this. Because of this provision, you're going to be asked whether or not there is any concern with the allocation percentages. If there are no concerns raised by any county, then the full amount can be allocated. If a concern is raised by one or more counties, then a process will have to be gone through with the council to look into, whatever data issue has been raised. And so that's why we have what we refer to as a 2% holdback share. Next slide, please. And so using the data sources that I identified, we have done the calculations and everyone has 2 allocable shares, one with the application of a 2% holdback and the other without the allocation of the 2% holdback. And so as we go on to the sign-on and procedures that are going to be described later in the presentation, we'll identify if there is any dispute with the county's allocation, and either the full amount will be dispersed or the full amount minus the 2% holdback will be dispersed. And once whatever data issue is raised, if one is, then there can be a reallocation of any leftover funds. And next slide, please. And I think that's just kind of following up what I was describing. So I think that's my part.
All right, great. Thank you, Michael. Okay, so moving into how we're going to disperse the money, there has to be a little bit of paperwork around this. And the vehicle we're going to use is a letter of agreement. So as I mentioned before, the Opioid Abatement Council office is going to email out a letter of agreement between the Opioid Abatement Council and each county. These will be sent via Adobe Sign. So the idea here is that it'll be fairly painless. There won't be any printing that needs to happen. It'll all be through email and the Adobe Sign process. We are targeting the week of January 23rd for sending out these letters of agreement. I do realize that's next week. We're still lacking a few addresses, and we're working diligently with those counties to get that information. But if you've received, if we've been in contact with you, it will go to the contact person. And so just going to be asking for folks to watch their inbox. All right, next slide. Within this letter of agreement, there will be several different categories with various information included. One of the main things is that the funds that y'all receive through the Opioid Abatement Trust Fund, it does say that the funds must be spent on opioid abatement and remediation purposes. There will also be a reporting requirement. This include, and the template hasn't been developed yet. We will develop this template and get it out to you very soon. But the reporting requirements will be on remediation strategies that were funded by the trust funds, the number of people who were served, when the funds were spent, and then the total amount of funds spent per strategy. And let me pause right here. When we're talking about the various strategies and then spent on opioid abatement or remediation purposes, we're going to go into a little bit more detail about what the specifics are here. And there is also a document that spells out all these various activities. Then thirdly, all the records shall be maintained in accordance with the state law. And there's a little bit more language about this within the letter of agreement. And then also within the letter of agreement, the council has designated a time frame for the spending, the allocation and the spending of the funds. The allocation of the funds must happen within the first 2 years, and then the funds must be spent within 4 years. And there will be more, there's more language about this within the letter of agreement. Okay. And for the contact information, we are needing each county's remittance address, and that would be in the form of a valid invoice or the hand-signed memo on the county letterhead, the federal ID number, and then responsible party contact. Again, we've been in touch with all the counties through email and then also calling the county mayors. If by chance you haven't replied to us, we're asking that you reply back to us this week at this email address, opioid.abatement@tn.gov. And again, at the end of the webinar, we can take questions. If you haven't received anything from us, or if there's still some questions or concerns about what it is that we're asking for. All right, we can move into the disbursement amount. And you can go to the next slide. So for the projected 2023 disbursement amount, we use the total amount available in the trust fund as of November 30th, 2023. And the way that the settlement was reached and the state law reads that we take that total amount and we take out the payments that came from McKinsey, which is an international consulting firm. That amount equaled $90 million, or $90,326,150. So going back to what Michael was talking about earlier, 35% of that is allocated to the counties. So for the payment for 2023, we're looking at $31,425,153. So that is the number that is used when thinking back to that grid that Michael showed with all of the percentages. We use this number, take those percentages, and then that's how we get the payments for each of the counties. Next slide. So we are targeting mid-February. I know that is right around the corner here. And we are a lot of hustle and bustle here at the Opioid Abatement Council office and the Department of Mental Health and Substance Abuse Services, working to make sure that we have all of the correct numbers and information that is needed to initiate those payments via Edison. And then we are hoping to put this into a process where we are dispersing the funds to the counties on an annual basis during the first quarter of each calendar year. So in the letter of agreement that you'll receive, there will be the dollar amount that your county will receive based on the percentage in the grid, and then also based on the $31 million, which is the county share of the Opioid Abatement Trust Fund as of November 30th of 2022. All right, next slide. So again, I showed this slide a little bit ago. Again, a quick overview of the payment process. Right now, we're confirming the remittance addresses and contact information for all 95 counties. Then using that percentage grid along with the 31 million number to determine the payment amount for each county. Then those letters of agreement will be coming out via Adobe Sign. Again, just please keep an eye on your inbox. And then once we receive the letter of agreement back, then we can start processing those payments via Edison, and they will be electronic payments. All right. Has Dr. Lloyd joined us?
I still haven't seen him. I've been trying to keep an eye on things, but.
Okay. If we could pause just a quick second, let me text him real fast.
While we're at a little bit of a break, if anybody has questions, if you want to type some in the chat, or like I said, we will provide some time at the end of this session to try to answer questions. And also, as I think I posted in the chat, but we'll make a recording of this available and the slides as well afterwards, so that anybody that you know who wanted to join wasn't able to today, they can watch the recording of this. Did you hear anything back from him, Mary?
I haven't. So we're going to go on and move forward. So going to spend a little bit of time on the remediation list. When we talk about what the monies can be used for, this is the document, and this is the source document for that information. And this is located on our website, and we have a URL for this website. Or for this information. This list was initially pulled together by the National Administrator, and the Opioid Abatement Council took this list and made just a few edits to bring it up to date. There was an older document, and then we're also referencing the Department of Health guideline in here. So this is known as the Tennessee's Opioid Abatement and Remediation Uses. All right, Dr. Lloyd, have you joined us?
Yes. Hey, Mary.
Hey, Dr. Lloyd. All right, just in time. So would you take a few minutes to introduce yourself, and then we are diving right into the remediation list and possible ways that the counties can use these dollars. So I'm going to turn it over to you.
Absolutely. Thanks, Mary. Mary, can you all hear me okay?
Yes, perfectly.
Okay.
Can see you fine just as well.
Guys, I'm sorry that I'm late, and I'd let Mary know, giving her a heads up that I was going to be a little bit late, but I want to tell you where I am because it's so important. So I can't turn my camera around, but I'm in the Rutherford County Jail in Murfreesboro. And I just spent the last hour and a half with all the inmates here in the workhouse, male and female. And as you all know, the vast majority are in here for substance use disorder, and a lot of them are in here for opioids. And so this is one of the things that we talk about in areas of remediation where we can make a difference. And I'll tell you who I am in just a second, but I'm still so excited because I got finished about 45 minutes ago, and I promise you I would still be in there taking questions if I had to come and see you guys, because this group was unbelievably engaged, and it was just, I mean, it's just uplifting for me to to be in there and be a part of something like that with a lot of people that a lot of society considers to be just stowaway, and that's unfortunate. But that's where I am, and that's what I was doing. I'm sorry I'm late. My name is Dr. Stephen Lloyd. Those of you who will ever talk to me, please call me Steve. The doctor thing can go out the window. I'm the chair of the Opioid Abatement Council. I work closely with Mary, who I love very much, and have worked with her at TennCare before now, and love having her. I am an internal medicine physician in Middle Tennessee, but I am a born and raised East Tennessee, and Jonesboro is my hometown. I also am in recovery from opioid and benzodiazepine addiction. I got help 19 years ago, so I've been in recovery for 19 years now. This is my passion. It's what I do. I own a series of outpatient treatment centers across the state of Tennessee that treat people with opioid use disorder using medications, including Suboxone and methadone. And although that may scare some of you, but we can talk about that further, because those two medications save lives. I serve as an expert witness for the federal government. Matter of fact, the money that we're talking about right now came to the state of Tennessee as a result of a case that I was the expert witness on in the state of Ohio. And I continue to do that. My ongoing case right now is in the state of Nevada around the same issues. So that's who I am. That's what I do. I have a wife and two grown children and no grandkids, and I'm salty about that. I'm very interested in this topic because our county mayors and our mayors around the state of Tennessee, get this money coming in from more different sources. Mary's already explained that to you, and there's different pots that it comes in. And sometimes it can be a question about what to do with it. And I'm a believer that solutions are local. I never got a solution from Washington, and I got darn few from Nashville. But I do believe that solutions are not local. I believe that local people are the ones that need to decide what their places need. But when it comes to addiction, that can be tough sometimes because it's so complicated. So we're in the remediation list right now. So basically every state that signed on to this lawsuit, in order to get the money that some of you have already received, the money that the rest of you are going to get, in order to get that money, the state's attorney generals had to agree that it would be used for this purpose. And this is where the remediation list comes from, because this is not like gallbladder surgery, guys. If you got somebody with a sick gallbladder, you cut it out, right? It's pretty straightforward. Addiction is all encompassing. We have to, number one, keep people alive. We have to treat them. We have to support them in their treatment. There's some of them that are going to need things around them in order to be successful, like housing and job training. And then the big enchilada out there is prevention in the first place. And so this is a complicated ecosystem that we're talking about. So as you guys start to get into it and start to navigate it, you can throw your hands up sometimes and go, what do I do? Where do I start? And that's really what we want to be a resource for, because I can't tell you what you need to do, but I certainly can give you some guidance on things that you might have questions about. And I'm always willing to help you. The reason I'm here at the Rutherford County Jail today is because the sheriff called me. And those of you on the line that know me, I know Jennifer Torville's on here. When I get those calls, I show up, and I will show up for you as well. So these states, unlike big tobacco money that we got, a couple of decades ago, could went for anything. This money can't go for just anything. So 15% from the fund administrator comes directly to the counties. And some of you all have already started to receive those checks. And if you haven't, you will. Another 15% goes to the legislature, as Mary has already shared with you. And then the remaining 70% is going to be split 35% to the counties and 65% under the auspices of what I do as chair of the Opioid Abatement Council. And if you look at the remediation list, it is comprehensive. Just about everything, hopefully everything that you can think of that your county, that your locality could possibly need is going to be in that remediation list. Now, the 35% that you get from the Opioid Abatement Council that flows through the Opioid Abatement Council, it has to come off of that remediation list. We can't tell you which one, but it has to come off of there. And we have developed a certification process for that because none of the members on my council want to be Brett Favre. So that exists. Now, the remaining 65% is going to be monies that are available to be applied for through a grant process that we're currently developing. But these are our big remediation list categories. If you're looking at where the most bang for your buck is, it's always going to be in prevention. So every $1 spent in prevention leads to about an $11 downstream savings. So that's the biggest bang for the buck. Next is harm reduction. Harm reduction is about keeping people alive. A lot of times we have these thoughts with substance abuse, oh, just stop using. You just have to quit. Don't, and guys, that won't get us anywhere. The problem now is that these kids are getting hold of illicit fentanyl and they're dying before we can get them help. So the first thing we have to do is keep them alive. We've got to try to prevent them from getting HIV disease from injection drug use. We've got to try to prevent them from getting hepatitis C. That is harm reduction. And I tell people all the time, I have not figured out how to treat dead people. So if anybody on the line has any way to help me with that one, I'm all ears. Another category is treatment. That is actual treatment of the addiction itself, which sometimes can involve medication like I talked about earlier, but always will involve therapy and the social determinants of health, right? Housing, job training, those type things. Recovery support. We know that people who are struggling with addiction do better when we have somebody involved in their lives that have lived experiences and can be recovery coaches. Education and training, part of what I'm doing here in Rutherford County and doing right before I walked in this room, I'm talking to you guys. And this was actually at the inmate level. And I'll tell you all this, I probably had 60 inmates in there. And those 60 inmates know more about addiction right now than 95% of the doctors in Rutherford County. And if we can continue to educate not only the people in decision-making roles, such as yourselves, but actually the people with the addiction themselves and allow them to be empowered, then I think we can really start moving on the education front. And then last but not least is research and evaluation of abatement strategy. What we want to know is we want to know that the money we spend is effective. Guys, if it's not effective, I don't want to spend it. If we're spending it because that's how you've spent it in the past and our results are poor, I don't want to do that. We're looking for innovation. We're looking for things that we can measure outcomes and see improvement so that we can scale those things to other parts of the state. All right, Mary.
Great. Thank you, Dr. Lloyd. Let's move on to the next slide, David. So where you can find the remediation list, this list will accompany the letter of agreement that you will receive from us. And the list is also posted on the Opioid Abatement Council website under our work. So if you go to the Opioid Abatement Council's website, the top bar that goes along the top, just click on our work. And there are several URLs there, and you may click on the remediation list. All right, let's go to the next slide for resources. There are several agencies across the state, and Dr. Lloyd, I don't know if you want to weigh in a little bit on this as well. Would you like to talk? Okay, go ahead. I'll turn it over to you.
I sure will. So there are agencies across the state that can give you direction. I know the state pretty well from Johnson County to Shelby County, and TADIS is the Tennessee Association of Alcohol and Drug and Other Addiction Services. It's based in Nashville, but we have good representation from the entire length of the state. In Northeast Tennessee, a big TADIS member that probably the Northeast Tennessee mayors will recognize is Frontier Health. And in Shelby County, all the way at the other end of the state, you may recognize CAP, which is Cocaine and Alcohol Program there in Memphis. So that's one organization statewide. TAMHO is the Tennessee Association of Mental Health Organizations. As you all know, a lot of people with substance use disorder also have co-occurring mental health issues. So TAMHO also works with the substance use population, and again, statewide representatives. We have licensed facilities across our state with regards to prevention, education, and treatment that are licensed by the state of Tennessee through the Tennessee Department of Mental Health and Substance Abuse Services. And you've got that list readily available for you as well. Medication-assisted treatment providers. Some of you probably have feelings about this one way or the other. I can tell you that those of you that have feelings that you're frowning right now, I certainly understand that based on some of the practices that you've seen in your local communities, and we need to stamp that out. Whenever you use medication in a way that's part of a comprehensive treatment program and fostering recovery, they're a game changer. And so the state of Tennessee licensed facilities now, and you can find those available at MAT at the link there, medication assisted treatment, tn.gov. They are licensed by the state. They are audited by the state. They are cited. Some of them are closed down if they're not meeting the standard. And then we've got a directory of addiction recovery programs across our state. So we actually have a lot of resources. The problem is you becoming aware of them and how to access them.
Great. Thank you, Dr. Lloyd. Right. When David sends these out, they'll have the links to these lists. And also we've developed some QR codes, and we will send those out, make those available to you guys as well, so that you can access these organizations. I've been in touch with the executive directors for both TAMHO and TADIS, and they know that we're sharing their contact information with the counties. So if you reach out to them, they will be expecting your phone call, and then we'll be so ready to help you guys link to a provider in your area. All right, let's move to the next slide. There's a few questions in the chat, and we'll get to those. But one thing that we're definitely curious about is what barriers or challenges do you anticipate with allocating or spending the funding? And also, kind of hand in hand with that, is there any way that the Opioid Abatement Council can support your county? So if it's possible, either to come off mute and let us know what your thoughts or questions or concerns are around this, or even drop them into the chat. We'd like to hear from you. And I can also take a minute to answer some of the questions in the chat. Will the counties receive that full amount, each county's allocations percentage of the 31 million plus just one time, or over a number of years? Well, the end of the question I'm going to answer first. This is going to be over a number of years. We're using 18 years as kind of our thermometer, barometer here, because Michael, is it the J&J Janssen settlement? Is that paying out over 18 years? Is that correct?
So a couple of things. Right now, the funds that are being sent out are from the distributor and the J&J settlement. The distributor settlement is the one that pays out over 18 years. And the J&J settlement has essentially a 9-year payout, but we were able to, because of some legislation resolving all the claims in Tennessee, we were able to have an acceleration provision apply for the J&J money. And that is why so much money was received last fall from J&J. We will now go several years without getting a J&J payment because we already have it. And so that means next year's figure from these two settlements will not be as high. The counties will not be splitting up $31 million from these two settlements next year. It'll be a lower figure from these settlements. It could be, and we're very hopeful, that there'll be other settlements that are finally inactive this coming summer, and that there'll be other money to go into the pot. So just where the dollar figure for each year will land is dependent on those other settlements coming through and everything else. So this is an unusual year because we had that big payout by J&J, but there will be annual payments for at least as long as the distributor payment, which is 18 years. They're just not going to be in this size. But with the other agreements, you know, it'll be a decent amount, and it won't ever settle in. It'll always be somewhat different. And we'll work to try to provide some outlook about the different settlements and what money can be expected to come in as we go forward.
Great. Hey, thank you for that. If you could just stay off mute for just a second, Michael. It looks like another question. Does Tennessee plan to allocate any settlement funds received from the Endo bankruptcy?
So the Endo bankruptcy, there is an agreement within that in principle. So it's pretty early on for the Endo bankruptcy. We're not looking to get a whole lot of money out of that. The entire amount that may come out to Tennessee over a multi-year period may just be between $9 and $14 million. What we are looking to do and what we hope will happen is that there'll be an agreement which would allow those funds to go into the Opioid Abatement Trust Fund and then have a sharing provision that would apply. Endo is a little bit different. There are some factors related to it. Some counties have previously settled with Endo, so everything's not locked down at all. But we would anticipate that someday, bankruptcies are very slow, someday money will flow from that bankruptcy into the trust fund.
Great, thank you.
Hey, Mary,
Yes.
somebody had asked about seeing the list of counties again. Is it okay if I go back
Yeah.
to that?
You and I are thinking the same thing. I was going to ask you to go back to that list. And I guess, Michael, would it be okay if we open it up to see if there are any questions around this? Because we're ready to send out the letters of agreement. And if there are no questions about the 2% holdback, we would like to do the full allocation. Can we see if any counties have any questions about this? I'm not hearing anything. Any concerns around the allocations?
Can you just explain that 2% holdback again one more time, please?
So when we were working through the data points that were used to generate these allocation percentages, we were trying to anticipate. We thought they were very good sources of data. They've been used in different ways to do a lot of allocation with these settlement agreements. But we did recognize that perhaps there might be an issue a county might have with the underlying data for that county. And so we wanted to have an opportunity for a county to say, well, we don't think, say, our overdose death count was correctly reported, or we're concerned about this measure really reflecting things here, and there's some issue with the data. And so we were just being very cautious in doing that, and wanted to allow for a process in which if a county thought the data being used had issues, it could challenge it and ask for a larger allocation. And so instead of automatically distributing the largest, the full amount, 2% would be held back to see if there were any issues raised. If there are no issues raised by any county, then the full amount can be dispersed. If an issue is raised by a county about the data, then 98% of the funds will be dispersed. And then the council will need to work through the alleged data issue, and then the rest of it could be released once that is resolved. And so that it's just kind of a cautionary process in case a county had an issue with the data. We're not anticipating that, but that's the reason for it. This is the first go around with it. And so we'll have, if we get through the process and there isn't any issue with it this year, we'll fully release all of the funds, and then we're good while we use these allocation percentages. And 4 years in, when we update the data, we'll have a period of time for everyone to review the percentages, the updated percentages that result from that. And we won't, and we probably, if we do the timing right, we can have that out there up for any concerns, and then if none occur, then the full amounts would, and you won't probably hear about the 2% holdback much more. But that's all it is just a precautionary process in case any county thought there was a problem with the data.
And another question came in, Michael. What information needs to be considered or evaluated in order to determine if the allocation percentage is accurate?
So we think the allocation percentage is accurate as far as it reflects the data that was put in, gathered by the Department of Health and otherwise. If if and I don't know the awareness of any particular county towards its overdose data and everything else. But if you wanted to look at that, if you want to reach out, we can provide you the underlying data that creates the allocation percentages. And if people want to take a look at that, again, we gathered up the data, we applied the data, but in negotiating how we were going to do things, we just wanted to provide this opportunity. We think the data is good, reflects those measures. But if someone is interested in taking a look at it, we can talk to you and see what the concern is.
Dr. Lloyd, there's a question that has come in. Can these funds be used for programming in the county jails?
Yeah, as I told you when I jumped on here hurriedly, just from my personal experience, the criminal justice system and county jails in particular have such a huge potential to bend the curve on this issue. And so if you look at the remediation list, yes, there is a lot of things in that remediation list that are around the issue in our criminal justice system, including county jails. And if you have any questions about it or want to know about programs or things that you could do or look at, I wasn't lying earlier. All you got to do is reach out to me, and I think there's some mayors on this call that have already done that, and they'll tell you the same thing. I will get back in contact with you and help you all I can. But there's a lot of ideas around how to utilize funds to help people who are struggling with addiction in our criminal justice system, with the idea being to prevent recidivism and then to get them back into the tax-paying citizen role, which is where we want to see our clients wind up. And Michael, I didn't see you on here, so I'm glad to see you here and helping us, because Michael Leftwich is just the work that he and the folks in our AG's office have done on this have been phenomenal to give us this opportunity.
Great, thank you. A couple of other questions. Does the letter agreement require commission approval? Short answer is no. What we're looking for is just a signature by the county mayor or the point of contact. That's the requirement from the Department of Mental Health and General Counsel. Let's see here. Another question, will the county have any input in the disbursement requested by the community agencies? That's under the purview of the Opioid Abatement Council. So that what Dr. Lloyd was talking about a few minutes ago, the 65%, the Opioid Abatement Council will review those applications and they will be making the determination for those funds. Anything to add, Dr. Lloyd?
Yeah, I want to address that one. So the short answer to that would be no, but with an asterisk. When you look at our application, and I think it'll take the form that we currently have planned, we want to see collaboration. Our now retired AG, Herbert Slattery, charged us with that. He charged us with setting up a system of care for the state of Tennessee for the next 3 decades, not the next 18 months. And part of that is collaboration with our resources locally and our existing medical system. So while they won't have to have the okay of the county or the place that they're located, we certainly want to see evidence of how they're going to impact and work with existing resources within the counties and regions.
Great, and that may be a good segue into this next question. Many counties are already short-staffed in their budget office. We do not have the staff to handle all this funding coming down. Who do you all see as being responsible for the expenditure of these funds? Could there be collaboration there as well?
So I guess my question would be collaboration with who?
Oh, well, the second part was mine. The last part question was
okay.
mine. Could
Okay.
they
I've got
collaborate
you.
with other people within the county?
Yeah, and guys, this is not going to be where my strong suit is, because I am very far removed from your all's day-to-day lives. I do have a friend on this call, Joe Grandy. I see a little bit of what Joe goes through, but and I think Mayor Lynch is from my neck of the woods in Unicoi as well. But I don't that I can't answer. I mean, because you're talking about allocations of funds that your county is going to receive. And I don't know that the council has any mechanism to help with that. Michael, am I wrong about that?
Well, I mean, I think yeah, I think obviously when the council does its work, it kind of, and it's already in this presentation, everything is providing resources and direction where resources can be found. I also believe that a county could choose to decline to take its share. I mean, I'm pretty sure that's the case. I need to check the statute again. And then, you know, and then money would still be used for abatement, but it would just be back in the hands of the Opioid Abatement Council. So I would want to confirm that, but I think that is an option out there. The idea that I believe the legislature was getting at in having these funds directed to the counties is to make sure that there's a base level of the settlement funds reaching every corner of the state. The reality, of course, is with the grants program and other expenditures, you know, that 65% is going to be spread across the state as well. You know, just whatever pool it ends up in, that money will go to a good use to address the problem. But if there is a county that's interested in declining the funds, we can look at that. I think that probably is possible.
Yeah, I would say this, you know, just thinking about it, give me just a second there while Michael was explaining that, is that, you know, if there are issues around that before declining it, I probably would reach out to my local anti-drug coalition. I think most of our counties have those and can get some ideas about maybe effective ways to spend it that could alleviate some of the burden on your own offices. I don't see anything at all wrong with that, because when I look at these counties, and I know the state pretty well from one end to the other, this is a problem in all 95 counties. And it's a significant problem in all 95 counties, even if you're not familiar with substance use, because it infects, you know, it affects your labor market, pressure on your jail system to, you know, to handle the inmates who are in there for these reasons. So I think with a little bit of work there locally, and mainly if you don't know anywhere else to turn, I mean, I will always try to give you guidance. You can always call me, but I would probably look to my anti-drug coalitions for help around that.
I was going to add in, Dr. Lloyd. I mean, I think the intent with this was not for every county to suddenly start running their own in-house substance abuse treatment program. The thought would be that you would contract with one of those mental health providers, one of those substance use providers, or if you have $100,000 you want to spend on a nonprofit that does drug education and drug abuse prevention programs, it would be that type of thing, not cutting individual checks over and over and over to fund all sorts of little intricacies of running a whole program. But it would be your opportunity to choose, do we want to spend the bulk of the money on prevention, on education, on treatment, and hopefully having contracts with existing providers to do that.
Yes, absolutely, David.
And there's a question in there about use for drug and recovery courts, and that's absolutely, I think, one of the things on that remediation list.
Yes, yes. Also another question, so entities will apply for funding directly from the council and not local government. That's right. So the agencies across the state will not be applying for the 65%. They're not applying to you. Now you may set up something with your money to have local entities apply for that, but we're not directing that. That's not part of this process. We're dispersing the money to the counties. You use what's on the remediation list. Did I hit all the questions there, David?
I'll just add in one other thing. I mean, Joe, Mayor Grandy had asked about, will the counties have any input in what's being dispersed to these the other 65%? I mean, there is some indirect input in the sense that our association the legislature is very generous in giving us 2 positions on the council that we got to submit names for. And Mayor Grandy, one of them is Lisa Tipton right there out of your community, who's doing work in that area. The other one is Judge Shane Sexton out of the Campbell County area, who's retired now, but he ran a drug court for a long time. So these are people that some of you all nominated and sent information to me about that I was happy to put on the council. I think they've got a career track record of doing a lot of great work, and they're there, and they've been in a lot of your communities doing work. So I think they have a good handle and an idea about things. When the council is meeting, they're very active and involved in the council, and they'll be there to help bring your perspective.
Yeah, I agree with that.
So we are ready to send out these letters of agreement, like I said, hopefully starting next week. Michael, what type of time frame do you think we might be on to hear back from the counties around the 2% holdback?
Yeah, I think we would want to at least have a little bit more notice. I mean, now that we've had this explanatory session and everything else, and we can perhaps chat about that and let
Okay.
them know what a deadline would be. But you know, I think we'd want to at least provide a week or so,
Okay.
just in case people want to look into that. But if not, then we can go forward with releasing the full amount of the funds.
Okay, great. Wonderful. Okay, David, anything else?
I think there's been one more question about whether the funds could be used for autopsy costs related to drug-related deaths. That one I don't remember seeing on the remediation list.
Yeah, I don't, David, I don't recall seeing that one either. To me, that gets a little more into, into medical and insurance claims and that kind of thing. And I've read the list. I don't recall seeing that either.
I would
I'm
say,
doing a word search. I'm doing a word search and it's not coming up.
Yeah,
And
and
Michael-
I think there's some things out there that maybe aren't on the list, but are close enough to it that you could make a case for, but I don't even recall anything being really close to that one.
yeah, I would say, Michael, correct me if you disagree, but the counties that are receiving a share of the 15% subdivision fund, that money to some extent was to reflect the fact that you have undergone damages as a result of the effect of this crisis in your community. So I think there's less restrictions on those monies you're receiving directly, and that probably could be used. Do you have any thoughts about that, Michael?
Right, yeah, so to be clear, the, ideally, everyone really encourages the use for opioid abatement going into the future and everything else. But in negotiating these deals, we did recognize that everyone had a lot of past expenditures that they were never going to really recover for, no matter how well we did with the settlements. And so the definition of abatement includes reimbursement for past opioid related expenditures, which I'm sure all the counties have experienced. And so there is flexibility with the subdivisions funds, and the rules for it are very much different than the rules for the money that we've been talking about, that 35% that runs through the Opioid Abatement Trust Fund. And so there's a lot more flexibility there, and the requirements and the list and everything else that we've talked about on this call don't apply to those subdivision funds. All you really need to be worried about with the subdivision funds when it comes to reporting and separating things out is if you end up using them some for attorney's fees and expenses related to the litigation, those have to be reported differently for tax purposes. You'll hear more about that. I don't know that that's really going to come into play a lot, but that's all about the subdivision fund where there is that flexibility.
Mary, I do want to say something here on the call today. We've got Jennifer Torville. Jennifer is a wonderful resource. Has been really really instrumental working with Jennifer for me for a number of years now. But Jennifer is the head of a smart policy group, SMART, through the University of Tennessee in Knoxville. That actually came about as a result of our president, Randy Boyd. They are I guess a non-biased entity that I think will be willing to give their input on things that the counties may want to talk about or they have questions about. I think that's a good resource for you, and I certainly would trust what is coming from that group if you wanted to reach out to them.
Transition.
We could include Jennifer's information in an email from David. Would that be okay?
Sure, yeah.
Okay.
And a couple of people have asked, but we will post the slides up there. Can you give your website again, Mary, just in case people were wanting to find that?
Oh yeah, can you go to the very last slide of the, and you can also do a simple Google search of Tennessee, or you can just type in TNOAC. But it's the Department of Mental Health's website. And then Opioid Abatement Council has its own section there. So there's our email address. Feel free to reach out to us at any time. Now have several people working in our office, so we'll be able to get back in touch with you. And there is the website as well. Recordings of our meetings, meeting minutes, the remediation list, the list of the council members are located at this website.
There's one last question that popped up about are there any specific instructions coming from the comptroller's office on tracking this? I think they have already created some new accounts in the Uniform Chart of Accounts for counties to be able to track the revenues that come under these account codes. And I said, that's, I think, Mary, have you been talking with them some about trying to help on the reporting or?
But the reporting so far of what we have is that slide that went up, just a few items that they're going to report. And as soon as we get that template together, we will share that with them. Well, we thank everybody for having us today. Again, like Dr. Lloyd has said, please reach out to us if you have any questions. And if you need to get in touch with Dr. Lloyd, just email opioid.abatement@tn.gov and we will connect you with Dr. Lloyd. Thank you guys so much. And we look forward to continuing to partner with you. And we're excited about dispersing these funds. Thank you.
Thanks, Mary. Thanks, Michael. And thanks, David.
Thank you, guys.
Yeah, thanks to all of you.